Hi. You're probably wondering how you're going to be assessed for this course. So what I want to show you now is what the assessment is comprised of. It's not an exam, so for some of you I guess that's good news. Some people prefer exams, some people prefer to do work. So in this course, and I've been doing this for many years, this type of project, you're going to be asked to do a project, a written assignment, which I hope will be of use to you when you go back to your regular jobs or when you perhaps look for new jobs. I can't say when you go back home because you are, of course, all at home. So the assessment, as I said, is a written paper, but there's also an oral presentation, which we'll do via Zoom, which shouldn't be a problem. And what you'll be asked to do is to select a public health problem in your country, preferably a nutrition problem, but it doesn't have to be. And what you're going to be asked to do is to have a look at the characteristics of this problem, and I'll go into the details in a moment. And I'll ask you to suggest an intervention. What you would do if you were given the budget and the time and the staff, what you would do as a newly qualified public health professional to solve this problem or to intervene. And the reason I've chosen this type of project is because it gives you then something when you go back to your regular work environment, which is a ready-made program should you be asked to use it. And we've had cases in the past where students have reported back to me that when they came back home, the students who were here obviously in Israel, that they then had programs which were ready, which could be tweaked if need be to suit the particular issue, but they'd sort of gone through the process of assessing and planning interventions and in a very holistic manner. So the project will be 95% of your mark, and 5% will be for your participation. Now, we're challenged because we're doing this long distance, but there are still many ways to participate, whether it's by the forum, and if we have some live Zoom sessions, that I'll be able to hear your voices, see your faces, and you'll get 5% of your mark just for being an active part of this course. Okay, so what are the components of the mark? As I said, 5 marks just for taking part, and then 30% of the mark will be for your class presentation, and then the written part is divided into 3 parts, parts A, part B and part C, and part A 10 marks, part B 20 and part C 35. And this is how it'll be divided up. So I'm going to describe each of these parts in turn. Okay, so as I said, you'll be asked to look at a problem. Now, if there are cases where there's more than one of you from the country, and I looked at the list this morning, but I can't remember exactly, usually there's more than one problem to be dealt with. You will have to work individually. The course doesn't allow for joint work. It's got to be an individual work. So what you'll be asked to do is set a presentation, which will be towards the end of the course, and I'll put on the Moodle, I think it's there already actually, what is the outline of the course in terms of our 14 weeks, and the presentations are towards the end of the course, and the written project will then be handed in roughly a month after the course is completed. Okay, so this is just some of the examples of what students have done in the past. And you can see by looking at these that they focus on a country, whether it's Kenya, Ghana, Nigeria, Cameroon, Guatemala, a particular group, women, children, or a particular age group, whether it's sort of the elderly or whether it's pregnant women, and then usually focusing on a smaller area. I don't expect you to go ahead and plan a program for all of China or all of a big country. If it's a small country, Fiji, or some of the smaller Latin American countries, which have got a smaller population, you perhaps could think of something which is nationwide. But generally speaking, you'll focus on a particular area, particular region if need be, and you can see in some of these examples that they've got a region, they've got a group, and they've outlined the problem. And what I'll ask you to do is to think about, you know your home country situations, I'm less familiar with them, and you'll think about what is the problem. You'll send it to me by email, or we can open a discussion group on the Moodle, and I'll then approve it or not approve it. I'll give you some suggestions. In my past experience, very often students have picked something which is too big, too large. So I've said, drill down, focus on a smaller group, a narrower age group perhaps, or maybe just one sex instead of men and women, just maybe on the men or just on the women. So there's something which is you could then plan and know which resources to use. So this is just some examples, and I will send you a couple of examples I'll put up on the Moodle of projects which students have done in past years. Okay, so we go to the class presentations. That'll be the first interface of your project with the class. You'll have about 8 to 10 minutes each to present it, just presenting the first two parts, in other words, the background and what your assessment will comprise. A few slides. I don't expect you to spend a huge amount of time on the bells and whistles of the slides. The idea is to get the information across in an attractive fashion, but I don't expect a lot of fancy footwork. And we'll talk about more of that, and I'll give you some examples of those from past students. Okay, so in the background, what I don't want to see is copy-paste 5 pages from Wikipedia or from some medical textbook, what is anemia, what is diabetes. The idea of the background is to briefly summarize the nature of the problem, and what's important is the context in your country. To look for statistics. There are loads of statistics available on the internet, whether it's WHO or UNICEF or FAO or local health surveys that have been done in your country, or other information from Agriculture Ministry or the trade and industry, and to give the problem its context in your country. Also describe briefly the area. If you picked a particular area, for instance, the student who described the situation in Guatemala described the geography of that particular area, so we understood why there was an issue of exposure to cold weather. So the idea being to give to the reader who doesn't know the local conditions some idea of how this problem is in that particular context, and that's very important. 2 or 3 pages, a bit of background, and obviously some references, because you will have to look up material. I don't expect you'll all have it in your heads. If you do, wonderful. Okay, so part B. Now this is a search and discover aspect. In other words, what you're doing here is you're trying to find out more about the problem, because if you're going to do an intervention, then obviously it's got to be based on information, not just a gut feeling, this would be a good thing to do. We need to know about the problem, who suffers from it, what it is. Is it a big problem? It just affects a very small population, affects the whole population, or just some subsection of the population? And this is what assessment is. Assessment is having a look at what is going on, and that then forms the basis of what you want to do, what you want to change. And broken down the assessment into 7 stages, we'll just go through each of those stages. Okay, so the first part is, in anything we do, we need to decide what we want to do. What are our aims and objectives? In assessment, we're not trying to change something, we're trying to look at something, to assess, describe, portray, examine, study. They're the sorts of words we use in assessment. And I've just given you 2 examples. One is to look at the association between early marriage and child malnutrition in northern Cameroon. In other words, an area, an age group, and a problem. Okay, so we're having a look at it. Before we decide what to do, we need to know how big is the problem. Is it a small problem, a big problem, a new problem, an old problem? Is it something which can be changed, cannot be changed? And these are the sorts of words we use. As I said, prioritize, study, describe. They're the words for our assessment. And I'll show you how we go about it. Okay, first we're going to decide how we're going to do it. Is it going to be a survey? We're going to do focus groups. We're going to speak to experts. Are we going to do a telephone questionnaire? Are we going to do some biochemical things? Obviously, in times like now, when we're perhaps limited in what we can do, we may have to be more creative. But it doesn't mean that we don't need to try to think about solving some of the problems. So we have to think about what is feasible in my current situation, in my country. What can I do to find out about this problem? What method is available to me? And then, okay, what method? And this is partly related to, of course, who am I going to look at? Who is a population of risk? If we're talking about infant nutrition, we're not going to look at the men who are elderly. So we need to look at the mothers, because they're the ones responsible for feeding the babies. We can't interview the babies. Okay, so we have to sort of think in terms of the problem, who are the people we're going to look at to assess the problem, to what are the determinants of the problem? And how are we going to go about doing it? Okay, so which sort of survey method, but what tools have we got? Questionnaires? Can we tape interviews? Do we need to do clinical examinations? If we're talking about anemia, do we want to sort of assess the subpopulation and measure the hemoglobin levels? If we're talking about other issues, do we need to look at documentation of immunisation? Do we need to look at percentages? Have a look at the records of the antenatal clinics or the postnatal clinics, what's happened to the baby. So what are we going to use? What are going to be our tools to do this assessment? And who are we going to work with? Nobody works alone. And the more people are involved, the more chance we have of getting a better picture. If we have too many people, it might be hard to manage. So we need to find the balance between how many people, how many groups, or how many different stakeholders, if you like, that's the word we tend to use, how many stakeholders we have to involve. And here's just some examples of different organisations. It could be an NGO, it might be your health ministry, it could be your statistical bureau, it could be the local religious leaders, it could be some sort of a health ministry or the agriculture ministry, education ministry. In other words, who are you going to work with to get the information? Who can give you insight into this problem? And again, if I go back to what I said originally, the idea being for you to think critically and holistically about what is going on in your own country. Okay, now having decided who you're going to look at, who you're going to work with, how you're going to do it, have to also think about how long is it going to take, and to build some sort of a Gantt chart. If you're not familiar with what a Gantt chart is, I will send you some examples where you then plan how long each stage is going to take and what can be done at the same time, what is dependent on a previous stage can be done later, and you have to work out some sort of timeline, and always assume things are going to take longer than what you planned, because that's usually what happens. And we're not talking about a situation of a pandemic. And then the budget. Now, if you're applying for a grant, or if you're doing a research project, or you're working with an NGO, you will probably be given a certain budget, or you'll be told to present your budget. And then it's not just saying, well, I need, $100,000 and I'll do it for you. The people who are looking at your budget want to know what you're spending the money on. Is it mainly staff? Is 80% of your budget staff? Or is only 20%? What are your overheads? Now, I don't expect you necessarily to put amounts down, but what I want you to think about is what sort of people, what sort of things you will have to pay for. Will you have to pay for an office? Will you have to pay for equipment? Will you have to pay for staff, or can you use medical students, or maybe nurses, or maybe trainee teachers? In other words, what are the elements that will comprise your budget? Okay, and I think that's very important. Again, I'll put up on the Moodle some examples of budgets for past students. So that's all part. So far we haven't done anything in terms of change. All we've done is an assessment. Now the next part is, of course, then doing some sort of a change, because all this is very well, lots of lovely information, but what are we going to do with it? We're going to use that as a basis for doing some sort of intervention. And I'll just go through the stages of the intervention, similar stages to the assessment, but with a different focus, obviously, because here we're looking at doing something to create change. In assessment, we're just simply photographing, if you like, a current situation and describing it. Here, we actually want to make change. And here are just some examples of what could be done. A media campaign, an education campaign, food labelling changes, working with food industry to produce some lower salt, lower sugar foods, lots of different possibilities of interventions. And again, you'll have a look at what's been done in the past about this particular problem. You know the context of your country, and that's going to help you to decide what would be a good intervention to use for this project. Okay, so again, we have to, of course, start off with an aim objective. We need to know what we want to do in order to decide how we're going to do it. So are we going to try to increase breastfeeding rates, reduce iron deficiency anemia, reduce obesity rates? What are we going to try to do? Okay, and we want to set a target, not to say improve the health of the nation. That's far too general. That doesn't give us any guidelines. We need to specify the problem. We want to specify preferably a time frame, but that's not absolutely necessary sometimes. We want to specify who we're looking at and what we hope to achieve, a measurable target. Not just saying we want to make sure the population loses weight. What's our target? What percentage of obesity do we want to reduce? Because if we haven't got a target, we can't really say at the end whether we in fact achieved what we set out to do. Again, who are we going to work with? Again, we had some partners for the assessment. It might be the same. There might be some other people we need to work with. Perhaps we didn't work with the media. Now we need to work with the media. Maybe we didn't work with physicians. Now we need to work with physicians. So again, in accordance with what we decide, we'll then pick our partners. And the more people that are involved, the more people are going to have a stake in making sure that it works. Because if you involve other people, they want to make sure that this thing works. So you'll have meetings with them and you'll set priorities, and that'll help. Okay, so we obviously have to decide the target population that's related to the assessment. And then we're going to give a detailed description of the intervention. And here, what I would like to see, what I expect to see, is a proper description of what you're going to do. Not just say, we'll give classes to the adults. What is going to be the content of the class? I don't expect to see detailed lesson plans, obviously not, but what are going to be the main topics? Are you going to teach, hygiene, food preparation, economic food budgeting? What sort of things are you going to teach? How to prepare nutritious foods for infants? What are the topics you're going to do? It's going to be education. It's going to be a media campaign. What sort of media? It's going to be radio, internet, television, billboards. In other words, giving details what you're going to do. So somebody else reading it can see, I can see where that money's going. Not just something very general and hope for the best. So in other words, giving some details based on what you've read and what you're planning about what you want to do. And here's just some examples of, possible interventions. And obviously you'll select those according to the problem in your local context. The timeline and budget, as we discussed before. What has to be done first? To have the stakeholder meetings, to develop your protocols, buy equipment if necessary. If you're going to do a massive immunisation campaign, have you got the immunisations? Are they available? If you're going to do some other campaign, you want to do billboards, are there billboards in the places you want to put them up? In other words, if you want to train community workers, are the people available? So you're going to plan it, and then you're going to implement it, and then what's very important afterwards is, of course, evaluation. Now, we'll go through this during the course. I don't expect you all to remember it now. You don't have to start to work on your project tomorrow. I mean, you can if you want, but I don't expect you to. But when I'll show you the different aspects, and the evaluation is very important, because it's not just enough to say we had a good time, or I managed to employ 3 PhD students and I gave them what to do. We need to know that the money that was spent, that we know where it went, and we know what was done with it and what was achieved, and we'll talk about evaluation. So that's basically your project, and I can wish you good luck. Students, and I've done this with many, many students, and it generally gives very, very positive results. The students learn a lot, and I think it's very useful in the future. So that's going to be your assessment. Thank you.